Hi, everyone. Welcome to ClicData's webinar. We're going to get started now, right on time. First of all, thank you very much for joining. My name is Telmo Silva. I am the CTO here at ClicData. And with me, I have Dan, who's just joining. The webinar is being recorded, and it will be available on our website after this shortly within 24 hours at www.clicdata.com. It will also be available on our YouTube channel. For those of you that are joining us and don't know ClicData at all, I just have this one slide, I promise, and I'll tell just a little bit about who we are and what we do so that you put things into context. ClicData is a BI data management and visualization platform. We offer all things related to connecting to data to over 250 different systems. We have connectors for databases, systems, applications. We also make a data warehouse available to you in the region of your choice, similar to what some of those tools you see there on the screen offer. We also give you some tools to do data management, data cleansing, data transformation, calculations, and so forth. We have a dashboard editor and coming soon a report editor as well. So we have a lot of different data visualization tools, as well as exporting data out to outbound systems and downstream systems. And finally, we also allow all our dashboards and reports and data to be shared and securely collaborated with your vendors, partners, employees, team members, etc. And that is ClicData in a shell. And with that, I'd like to get right into the topic of today, which is performance measurement for the healthcare. So I'll pass it over to Dan. And again, if you have any questions, please don't hesitate to ping on the chat. Dan, over to you.
Thanks, Tomo. Good morning, everyone. Just to give a quick intro on today's agenda, we'll be talking about performance measurement and more specifically performance measurement in a healthcare setting. We'll talk through kind of what the ins and outs of performance measurement entails, some use cases and scenarios, and how that may be applicable to your business. And then we'll walk through a quick demo or illustration to kind of show some of the outputs of what a performance measurement program or process may entail, specifically related to healthcare. So to start, we just want to talk about what is performance measurement. In general, performance measurement is a process or an organizational concept. It's normally continually done within the organization, and it's a process around setting goals and responsibilities for improving the performance, whether it be in certain areas of the organization or just as across the organization as a whole. It gives process around who's going to analyze the outcomes, how we're going to analyze the outcomes, and giving those responsibilities around that, and provides a governance around that as well. So that's kind of more of a program type of thought process around performance measurement, all with the end goal of really, at the end of the day, improving performance, either in specific areas or even measuring that performance as it relates to certain changes that you may want to make within your organization, and evaluating whether those changes are either having a negative or a positive impact to what you're doing. So within the healthcare space, as we talk about it, performance measurement matters, maybe even a little bit more than some of your other business sectors. For one, health is important to a lot of people. It's very important, more so sometimes than the goods or services that you may purchase out in the market. And we spend a lot of money, especially here in the United States, from a healthcare perspective, a lot of money on ensuring that we can get good outcomes. We can, get access to the healthcare services that we need in a timely fashion. And so around all of that, performance measurement is important for making informed decisions about what is working and what is not working, and applying some continuous quality improvement objectives within there as well. This all allows it to be more efficient processes and healthcare policies, which ultimately should result in reducing overall expenses related to healthcare delivery. At the end of the day, that's the end goal. And hopefully, with using a performance measurement process, you can kind of institute that within your organization.
Again, just to before you keep going, and I know
Sure.
we come from a pharmaceutical background. I mean, ClicData was built out of the pharmaceutical industry, and we always called ourselves healthcare. We're in the healthcare industry, right? And the healthcare sector. And I just want to kind of fine tune to make sure that everybody attending understands that here we're actually talking about healthcare as in the health providers sense of the word, the hospitals, the clinics, etc. Correct?
Correct. That's more of the focus in relation to this. It's not to say that you couldn't have that focus in the pharmaceutical sector. It may just have a different take on what you're trying to improve performance on. But most of it is focused on around your hospital and provider measurement.
Excellent. Thanks.
Sure. Just to talk about what the objectives for measuring healthcare performance may be. We always talk about, we may have a perception versus reality, and one person's perception versus another person's perception may not always align, and we may see things a little differently. So one of the objectives within performance measurement is to really get an idea of what is our focus. And understanding that, what are the things that we perceive are working or are not working? Are they really things that exist, or is there a different reality to what we think is going on within our business? It also helps us to set a baseline for how we want to measure our performance. So in some cases, you may not even have done any performance measurement to know where you stand. And so without doing that measurement, you have no idea whether that's good or bad, and what improvement may look like. So it also allows you to establish that baseline and make decisions based upon that evidence. So something that you may have thought was a problem before, and you were going to initiate a program to solve it, may not be as big as a problem as maybe something else. So that gives you the evidence to kind of proceed forward with whatever decisions you're going to make around the changes that you want to do and lead to improvements. It also may indicate that, maybe some changes didn't work as expected. So you may demonstrate that it did lead to improvements, or it may demonstrate that it did not lead to improvements, or things got worse for one reason or another. So it allows you to have your finger on the pulse of what's going on related to changes that you may be making. And it also gives you the ability to have some sort of peer comparison within the marketplace, so that you can see how you're doing with like practices or hospitals across the industry, and also be able to kind of model some of what's the best practices that they may be using, and maybe refine some of your processes. A lot of it is also built on, once you've started measurement, you can prevent yourself from maybe sliding backwards as well, and set targets, and make sure that you're always kind of meeting your targets and related to that. And also to recognize that you have improved performance, and that also may have a moral concept to it, or a morale concept to it, in terms of telling your organization that yes, we took on this initiative, and now we've had better outcomes as a result of it.
Just another question on that in terms of peer comparison. So I can see how that works, for example, on a centralized or subsidized health system, France, UK, etc.
Mhm.
Because I mean the data is centralized, right? It is funded by the
Right.
government. And so in essence, they're getting the data back. Is that the same in the US? Are the hospital groups and hospitals and clinics willing to partake this data for comparison? Or is there an anonymization process? Obviously, I'm assuming in data protection, but is there that willingness to share that and to exactly improve these metrics, or to follow these metrics?
Right. I will say in healthcare in general, there's always a willingness to share information to improve metrics. my experience is that there's always a continuous improvement effort that everyone wants to share. Now, granted, they don't want to share confidential information about how they perform, and usually what they do is provide that information to a service, which we'll talk about later, and they may take that data and anonymize it. What you get back in return is also, if you're providing data, you get data back as kind of a feedback loop to say, okay, this is what you provided or what you have, but when we put it into the mix with 1,500 other hospitals or something like that, you can get a better understanding of how much you stand against that, and then be able to share best practices.
All right.
The types of performance measurement that we have, we kind of broadly classified them into different levels of performance measurement that you may undertake. Some may start at the patient level, and manifest itself primarily as how well was that patient level experience taken in terms of a process or an outcome or a treatment that they had, or the service that they had within the organization. You may also look at it from a service or program level. For larger organizations, you may have different programs or initiatives that you need to look at for how well is that diabetes management program executing. Is it having the preferred outcomes that we want in terms of results from trying to stand that up and get people into that program, and what is the positive or negative impact of that. We also may look at it from a system level standpoint, where we need to understand where are our resources being allocated at the system level, and understand is it are we focused on the right things? Are the resources allocated appropriately across the whole entire system to support all the things that we want to do? And then kind of more to the population level, we may look at that in terms of healthcare policy. And kind of the thing that's top of mind for everybody is COVID, and what is the population level experience from that broad. How do we do broad policies and broad planning to bring to the forefront what could be done better, because we're monitoring how that's working out in the real world at a very big broad level to help inform policy decisions by our leaders. Then the question becomes, as an individual organization, what should we measure? Obviously, depending on the type of organization that you are, there's a lot of different things to take into consideration, and you really probably know best about where your pain points are. But at the same time, there are also some things that can help guide where we should start our measurement, and what things we should measure. Kind of broadly, there's three different categories that I break these into. One is regulatory, which may be in the US, it's the Centers for Medicare and Medicaid Services, and they may be running different programs or different quality measures or incentive programs that you might want to participate in. And so those are kind of things that you would have to provide information on to that organization in order to participate anyway. So there's certain measurements there related to that. We also talk about industry standards and benchmarks, which we were kind of referring to in a few slides back, where we want to see how we are in relation to our peers. And by providing information and then also measuring ourselves against that anonymized data that we get back in return through benchmarks, we can kind of determine which things, or which areas we may want to focus on based upon how we compare to the industry, and how we compare to practices or hospitals in the industry as well. And then the third is internal budgeting and goal setting. So while industry standards and benchmarks are great, there may be some things that you need to adjust that are more localized to your organization or your business, or the market that you're in, because maybe the industry standard is great, and it's a nice ideal place to be, but you may not be able to get there within a certain time frame. So a lot of times you may use internal budgeting or goal setting that work in conjunction maybe a little bit with the benchmarks to be able to say, okay, this is a 2 to 3 year plan, and this is how we get there by setting intermediate goals and budgets that are going to allow us to get there, and being able to track against those using a performance measurement process. The resources associated with that are varied. Here in the United States, we have the Healthcare Financial Management Association, which they provide guidance and information related to revenue cycle and finance within the healthcare sector. Again, the Centers for Medicare and Medicaid Services, they also provide a lot of very useful information that you can glean based upon reports and everything that they provide. And also the benchmark sources that we talked about. There's a lot of them out there in the market. Just a few examples are listed here. And then there may be also more focused or specialty specific benchmarks, depending upon what type of services you are providing within the industry. So those get a little bit more detailed and a little bit more focused. And if you're looking for just kind of broad financial metrics, you may look at HFMA. But if you're looking at for performance in terms of specific to my type of practice or type of services that I'm offering, you may look at more specific ones. Something as anesthesia may be measured a little bit differently that is not provided by the Management Group Management Association.
Hi, Dan. I had a question on this, which is basically, these
Right.
probably exist in some shape or form in every country. These are very specific to the US. I just want to kind of reaffirm two things, actually. The first one is the stuff we're talking about is applicable to all different types of different health systems in a sense, to a certain extent, I'm assuming, but I just wanted you to confirm that. And the second is about these data sources. Are these available, openly? Are these accessible? Can anybody access this data? Are they paid? Like, what is the terms of level of access to this data?
Sure. Yeah, in answer to your first question, there are a lot of concepts and a lot of things that may apply or cross apply to countries just based on, if you're talking about like wait times or getting patient throughput and how long it takes to process a patient through the healthcare system. So there's a lot of things like that are still applicable, and then measures that might be related to specific procedures, that how they're performed, and you may be able to use that same information across countries. Other things are maybe a little bit more specific to the U.S. Or specialty specific. And then with a lot of these sources, the Centers for Medicare and Medicaid Service, the information that they provide, there's a lot of information that's public. Or if you're participating with one of their programs, you obviously have access to that information that you need to provide. Some of the other ones here in terms of benchmark sources and healthcare financial management, there may be some association fees or subscription fees associated with that, because they are performing a service for you, in addition to also providing you data and information. So there are some fees, and sometimes you may not do that. You may not utilize those services every year. And maybe that's something you do once every 5 years to do some benchmarking. But sometimes it's an investment that you make to really kind of level set and keep you setting that baseline per se. When we talk about some of the typical KPIs that we should be looking at, we kind of break those up also into between clinical and administrative and operational. Some of the typical clinical ones that may apply across countries is your hospital acquired infections, readmissions, prescribing patterns or certain procedure utilization and antibiotic utilization, and patient safety, which has become a big one with COVID, and looking at, has the patient safety improved or decreased since the time that we, had COVID come about. And then, some of the operational, administrative, that may be a little bit more specific sometimes to the U.S. market, especially in terms of days to bill or days to collect, depending upon the reimbursement structure of the country you might be looking at, and expected collections and accounts receivable. So there's a different reimbursement methodology, and that's where maybe sometimes the typical KPIs that we look at, maybe on the administrative side, aren't as clear cut to be used in other healthcare marketplaces. So then we just kind of come back to the basics. What are the things that we, should be looking at and making that decision about what we're measuring? It still comes back to the same things, and it's kind of across. It's not specific to healthcare, but are these things aligning? Are these things that we want to measure truly measuring according to what our business goals are? And do they really measure progress of where we're at? Do we need this because it's some sort of regulatory requirement, or is it just something that we need because we want to look to see what that metric is? And also, do they have the ability to reveal trends that I'm expecting to see? And so that's really kind of some of the big decision points that you would still have to kind of come back to when deciding, for a performance measurement program, what things I should be looking at, or what things should I focus on first.
It's interesting that you bring this up, even in the healthcare industry, that this is happening, right? It's kind of our daily discussions with our customers in terms of saying, okay, just because you have that data does not mean that you need to report on that data, right? There has to
Right.
be there you have to work at it from the top down to say what is important to identify to make positive changes, right? Or whether there's as you said, a regulatory issue at hand that we need to provide this data, which whether that is actually useful or not, there may be a point where both cross, right? But we do find a lot of times that people are reporting on data just because they have that data, right? As opposed
Mhm.
to really saying, no, it has no potential to reveal trends, or they don't really matter to our business. So these concepts, as you said, are totally applicable across any industry.
Correct. And it's always that same old thing is, if you build it, they will come. Well, that's not always necessarily true. Just because you've built a lot of KPIs, that all those KPIs are going to be something that everyone's interested in, and sometimes it gets lost as to whether that truly resonates with your organization. So we talk about that, and we say, we want to do performance measurement, and where we start to get to is, what are the barriers to actual performance measurement in healthcare? It's probably the same across industries. I tend to see a little bit more in terms of data fragmentation and latency within the healthcare market. I've kind of highlighted here in orange, some of the things that I see are barriers to really starting that program. There's sometimes a large upfront investment that's needed in terms of, oh, I need a data warehouse, or I need resources that can manage the servers and systems like that. And then so that's going to be that's going to delay our time to value. When can we actually see something with the information that we've provided? And so, some of the bolt-on platforms that maybe they have to do some of this, they may not fully address all the needs that you actually have. So they may address, 5 to 6 of those needs, but then that, if you need additional connections to other data sources, that data is still fragmented and sitting in different systems across that whole cycle of the healthcare spectrum. And so a lot of those things highlighted in orange kind of relate to coming back to and saying, okay, the things in gray, do I have the resources to allocate this? Is there, do we have executive sponsorship to be able to move this forward? And the last one, it's kind of anecdotal to it, but the use of benchmarks can be overwhelming and where to start. But there's a lot of valid things that you can do with performance measurement, even if it doesn't involve the benchmarking. But hopefully, what you can do to get that executive sponsorship is understand that with something like ClicData, you don't need necessarily that large upfront investment, and you can see a time to value that's much shorter than maybe standing up some of these bolt-on systems that you may have, and still add to the mix other data segments that may not be available within those bolt-on systems. As an example, I just like to talk through, at least in the U.S. market, revenue cycle is kind of a good, easy example that everyone kind of understands as we talk about the different steps that the revenue cycle process in the U.S. takes, and then that process always has a number of different potential failure points or handoffs with either different systems or different resources within that process. From the step of the patient actually getting an appointment or knowing about your organization and signing up for an appointment with your organization, to the point where the patient comes to to the office, and now you have intake staff that need to verify your insurance. And then the patient has to wait, and then they can be seen by the doctor and have their treatment and check out. But after that, then comes the billing process, where the medical biller might have to prepare the claim from the doctor's notes, and that takes time to pull together as well. And so then the medical biller submits the claim for adjudication to health insurance payer, which goes through another set of systems or set of hands, and they may pay or they may not pay. And so there's some questions that need to be answered there about how timely are we getting that information back? How timely are we turning around this whole cycle to receive a balance or to receive a payment at the end of the day that's considered a payment in full, that consists of maybe potential payment from the patient and also payment from the health insurance carrier. So the questions that you need to answer around that may all come from may all rely on different data sources to answer that information. Did we get paid as expected? Was the patient happy with their experience? How did they find us? How did they get in to see the doctor? How long did that take? How long did it take for us to create a bill once they, left the office? How long did it take us to get reimbursement from the health insurance carrier? And did that take 2 or 3 tries? And so all those different questions, to be able to answer those, may be sitting in different data systems. These data systems aren't necessarily always, in one place that you can pull all that information together. So we'll just quickly flip over to a quick demo and look at some examples that we show from a performance measurement, and we'll walk through maybe some of the common items that I like to show from a healthcare perspective. What we're showing here is an example of a labor analytics focus. This is focused maybe on a hospital that may have multiple hospitals within that hospital system, and it's focused on what is the productivity of the labor that we use within the hospital, the non-physician labor within the hospital. And where are those resources aligned? And those resources may report to a certain VP or up to certain entities. And what is the productivity of those resources? Are we overstaffed? Are we understaffed? Can we drill down and see, okay, well, we have a VP that maybe, seems to not be performing as well. What are the departments associated with that VP? And can we drill in further to see, what we can glean from their productivity? Do they have the sufficient number of FTEs? Are they overutilizing overtime or contractual labor, so that our expenses are going up and being associated with that? So this is an example from a labor analytics standpoint from a hospital system. We can conversely kind of look at it from a provider analytics perspective, where we're looking at the performance of physicians. Productivity from a physician or performance from a physician has a different set of metrics, and how you measure that is different from how you would measure your labor productivity performance. So there's different KPIs associated with that. And we talk about it in terms of work relative value units. And what we're showing here is really just, they've done the work to do, what is it that our goal is the benchmark. That's where we want to be. But then they may be also setting some budget and stretch goals that they know that, they're not going to be able to meet the benchmark. That's just one indicator for them. But they don't want to solely focus on the benchmark. They also want to focus on, well, what do we actually know based upon our market, and how many physicians we have on staff, and what we anticipate for the next year in terms of volume, and the types of volume that we're going to get. What is our budget? How many more physicians can we hire? How many can we have on staff? So that translates into how much work they're going to be doing. And then also maybe setting some incentive or stretch goals, which ties into maybe the physician compensation plan or things like that. In addition, they may want to look at okay, how easy is it for patients to get access to us? What's our arrival rate? How often are we getting new patients? How often are we, canceling appointments on patients because we're not able to fulfill that patient's appointment for one reason or another. So this gives you kind of a broad overview of how that physician practice is working, and monitors that performance measurement on a monthly basis. Additionally, you could also be more specific. When we talk about perioperative analytics, we're looking at the performance of the OR environment. How efficiently are we using the ORs that we have at our disposal? How many cases do we have? What organizations have the most cases within there? How long is it taking us to perform a case, and what's our average turnover time? The less time that you're using the OR, that's time, that's money that's being lost. So if it's taking you longer to turn over certain types of cases, you may want to look into that and understand where your performance needs to be in terms of that turnover time. In addition to getting started at the beginning of the day. If you start late, then that means that everything further down the line during the day, if that first case is not on time, that may have an impact to cases further down the line, require more resources to stay on later, maybe potentially more overtime, and so that's going to affect your bottom line at the end of the day. So there's a lot of different things that we talk about measurement here, and this is just a few examples when we talk about healthcare performance measurement, where we would want to be focused.
Excellent, thanks. So I think you discussed labor analytics, basically related to basically the labor, staff technicians, staff outside of providers, in essence.
Yes.
Then you have your provider, which is looking at the surgeons, at the doctors itself, providing the services to the hospital. We looked at peri-op, which is the operation rooms, the tables, the equipment, almost in a sense. Are we utilizing these machines? MRIs and these things are very expensive. They need to be amortized and used
right.
as quickly as possible, as fast as possible, and so forth. So all these things are on peri-op. And then you also talked about where does revenue cycle management really fit in there? Is that across all those, or is that worth filling on that?
Yeah, so and it also depends on how the organization has set it up to run their revenue cycle, whether that's being run by individual departments, if we're talking about a hospital system. But the revenue cycle kind of spans across all of that. Or when we look at it from a labor analytics perspective, that's maybe one department within that whole labor analytics spectrum. But revenue cycle just has a lot of potential inefficiencies or efficiencies to be gained. That's why there's usually a focus on revenue cycle, because if you do things very efficiently within the revenue cycle, you're not expending resources to try and follow up and get the payment, which at the end of the day it impacts your bottom line just as much as focusing on these other areas.
Gotcha. And now this is an interesting thing because, and this is, I'm asking a question, would I actually know the answer to this. What Dan was showing there is actually the ClicData dashboards embedded into a solution that we call the healthcare performance analytics platform, which basically is the combination of this, of work we've done in partnerships. And so it's actually our dashboards embedded into another application, meaning that some of these can also be embedded in other internal systems within a healthcare facility and so forth. Dan, thank you very much for this. We will put on the webinar recording, we'll actually put a quick note and an email if you need more information on this. If you want a personalized demo of our healthcare performance analytics system, we'll make sure to have a little link there so you can book a demo with Dan and have more detail on the area. That if you have any other comments, would love to hear from you. With that, I'd like to thank everybody, and again, thank you for taking the time out to see this, and appreciate any comments. Take care. Have a great day.